Welcome to Fairy Tale Access, where the head fairy's quest is to prove that fairy tales do exist in actual time rather than once upon a time. Together, we will unravel the heroes, young and old, who turn dreams into reality. These are the people who still believe in happily ever after. The discoveries will bend even our most cynical non-believers into believing in fairy tales. Hi, welcome to Fairy Tale Access. Today, I'm excited to introduce you to Dr. Peggy Gregory from Ageless Medical Spa with some of the new advances in body sculpting and self-care. Thank you for joining us.
Oh, I'm very pleased to be here. I'm glad that you have me on so I can share what we do at Ageless Medical Spa, how we can help people transform their life, their bodies, their skin, make them feel better about themselves and having a more positive outlook.
Can you tell us a little bit about your background?
Certainly. Glad you asked. I'm a medical doctor. I was trained in Boston at Tufts. I do have a specialty in obstetrics and gynecology, which I did in Pennsylvania, a town called Abington. And then I came back up to New Hampshire, where I'm originally from, the Massachusetts and New Hampshire area. And I've pretty much lived here most of my life. So it was fun to come home and be closer to family and be able to bring my medical expertise to the surrounding communities.
But why switch from such a lucrative career to the medical spa industry?
Good question. I really enjoyed my patients and my time with my obstetrics and gynecology practice. However, after a certain amount of years, I needed to be able to prioritize my family and myself over the hours that I was putting in. So I knew how to use lasers and I have a good surgical background. And I looked to see, well, what can I do to help women and continue to practice medicine and continue to be in a very helpful journey for women of all ages. We have men clients too. And so it's always fun and exciting, and it brings the tools that I already had into being able to deal with women's and men's problems as they were getting older and they were seeing changes in their skin, changes in their body. And it's exciting to be able to help them and have smiles on their face. We have a lot of fun, and clients are very appreciative of what we can do for them.
Absolutely. Well, it must be great for you because now you can have a set schedule. You're not called in to deliver a baby at who knows what hour.
Yes, now we're pretty much a 9 to 5 and some Saturdays. But the nice thing is I do have some continuity with some of my old GYN and obstetric patients. So it's really a lot of fun. I've seen, the children that I've delivered growing up and, getting married. And I see moms that I've delivered their children. And I'm just bringing them through a different transition in life from that of early childbearing to now graciously growing older, looking nice, feeling better about themselves.
Talking about feeling better, let's start with M-Sculpt.
M-Sculpt. M-Sculpt's a great new way of using high-intensity focused electromagnetic beams. What it does is it basically contracts your muscles. So I can do a procedure for someone where they can be fully clothed. We just don't have any metal in the area. And it can do 20,000 abdominal crunches in one setting. This is an FDA-approved device to help strengthen your abdominal muscles. It can be used on the abdomen. It can be used on the gluteal muscles, biceps, triceps, as well as calf muscles. We're lucky to have Denise here today, who is going to be undergoing our procedure. And we're going to do her abdominals today, and it's going to be the equivalent of 20,000 abdominal crunches. Let's get the machine going. Okay, this is going to be a 30-minute treatment. I've inputted her data. The machine wants to know basically her age group, her sex. We're going to put in what part of the body that we're going to be treating, and then we're ready. We're set for 30 minutes. I'm going to go ahead with the sculpt paddle to use an electromagnetic energy to contract those muscles. So we're going to go ahead and start stimulating those muscles. You'll hear a little bit of a noise, and then you'll start feeling those muscles contract. Just like doing crunches, but without ever having to put in that effort. So you can sit here, lay here on the couch, and do a full workout. You're going to feel minimal amount of abdominal contractions. We're going to continue to increase the energy level, making sure that you're comfortable so we get to 100%. We're going to do this twice a week for 2 weeks. And you're going to continue to see increased improvement with your muscle mass. It'll take about 9 weeks for the full muscle growth to occur. And we'll also see, added benefit, a little bit of adipose tissue or fat reduction. So we're going to activate the fat cells, and they're going to be absorbed by the body. And then in 12 weeks, you'll have a slimmer abdomen and tighter core. And it's a great way to tone up those muscles that, maybe have got a little atrophied, a little lax over COVID when we haven't been outside and doing as much activities as maybe we normally have been. Or, the woman who has been taking care of children and running around balancing home life and work life and hasn't been getting to the gym. So we can give her a real good boost, increasing her confidence, increasing her core strength. Core strength is everything. When you're dancing, when you're walking, when you're doing just daily life, it's so important in so many aspects.
I know the results are astounding. Thank you for letting me try it.
Oh, my pleasure.
Okay, we won't leave that picture up too long. But next, the Vanquish.
Vanquish. Vanquish is another type of radio frequency device, and basically it helps to get rid of fat. So most people will know about cool sculpting, which actually freezes the fat. Mm-hmm. This takes the opposite approach, and it's going to use radio frequency to basically warm the tissues so it's comfortable. It helps reduce circumferential, so it's going to decrease your abdomen. So when you take that tape measure around, you're going to notice a nice improvement. We also have an applicator for thighs, so that's really popular as well. They're made by the same company, and so the instruments work well together.
Great, which brings us to your package deals in a minute. But with the Vanquish versus cool sculpting has been known to have some problems with the way fat gets distributed, and they have to massage it out after. What's the difference with Vanquish?
Vanquish has not shown that shelving is what you're alluding to. Mm-hmm. The Vanquish, because it heats overall the area, you're not getting a sharp demarcation between the treated area and the non-treated area. The heat dissipates more evenly into the tissues. So we're not seeing that with the Vanquish, which is exciting.
Yeah, it's really comfortable too.
Oh, like a warm hug. I really love it.
That's great. And Emsella.
Having been a gynecologist and seeing a lot of women with urinary incontinence issues, and knowing that so many people have come to me in the past to say, oh, what can I do? Maybe I cough, sneeze, maybe I have a little bit of a dribble. And the mainstay was surgical. Now we have another option for women so that they don't necessarily have to have surgery. And we've seen so many disappointing outcomes of surgery, especially using mesh type of procedures and urinary slings that go underneath the urethra. The Emsella uses the high intensity electromagnetic, and it does pelvic floor exercises for you. So it does Kegel exercises, and it's been shown again to help women with the mild incontinence. It's FDA approved for both men and women for all types of incontinence. They're undergoing studies now for sexual health as well. So it's really exciting to be able to offer treatment that so many people need, but don't want to talk about. And,
Right.
also they put up with it because they don't want to have to go to surgery. So it's an awesome procedure, and I'm very excited about it.
How many treatments does a person have to have?
Hmm.
Does it vary per individual or?
Certainly. Well, the protocol is going to be twice a week for 3 weeks. And then if you're still having some issues, then you'll continue and maybe do a few more cycles. Personally, I'll share. I ride horses. And so I was actually the first person on the chair, and it's totally helped me, as well as the M sculpt for helping my core strength so I can exercise better. I don't get as tired when I'm actually out on my horse riding. So I've found these machines to be beneficial in my own life. So I know they'll help other people.
Well, when I looked up some of the reviews, um, women said that it did help with the incontinence, but that it also helped tighten that vaginal area.
Hmm.
Is that
Yes,
typical?
sure. Because it's contracting those muscles, and you're getting a a focused beam right into the vaginal area, you're gonna increase those pelvic floor muscles. So they're gonna become thicker, they're gonna become more controllable. You're gonna tighten that area up. So women use it for more than just incontinence.
When you're one I read from England said that it felt like a rubber band snap, except not as bad. How would you describe the feeling so people had a better idea of what it felt like to sit on that chair for, is it 20 or 30 minutes?
Right around 30 minutes, yes. I didn't feel like a rubber band snap. A lot of different types of laser therapies feel like that. Lasers for hair removal or lasers for intense pulse light. When I'm first turning the machine up, it feels more like a fluttering,
Mhm.
and then you can just feel the contraction. There's one set of waves that does help to reduce lactic acid, and that can feel a little bit more like a tapping, but certainly not as uncomfortable as a rubber band snapping.
Well,
Like,
that's good
ow.
to know. That's why we needed to hear from you. And so with M-Sculpt, you kind of feel a vibration, and then a
Mhm.
few days later, you're actually like, I feel like I worked out.
Mhm.
With Mcella, is it the same type of feeling a couple days later, or?
I've never gotten any feelings of working out my muscles after that. And the M sculpt for the abs, it depends on the person. Both of these machines do have wavelength, their energy is in such a manner to help reduce lactic acid buildup. So you're not as uncomfortable as if you had actually done 20,000 abdominal crunches. I wouldn't be able to move for a week.
Right.
If I had done, well, first of all, I wouldn't be able to do them on my own.
Why is it important to lower the lactic acid?
That's what causes the discomfort after you work out. So lactic acid buildup, and it's irritating. So you're going to get that soreness. So drinking plenty of water helps after any type of exercise. Um, but the genius of this is it doesn't accumulate using the M Cellar and the M Sculpt.
Wow.
I know, it's awesome.
So have your patients had good results?
They've had awesome results. I think you might be able to show some of them.
Definitely. So with M-tone, what's that?
M-tone. M-tone is another way for body sculpting. It's going to use radio frequency and percussion. So the percussion is trying to break up those little fibers that pull down, causing cellulite. So cellulite is basically some fibrosis and tightening of the fibers that connect the lower levels of the muscles and fascia to the skin. And as we get older, those get tighter and they pull in dimples So we end up with that visible cellulite, and that happens over time. So the M tone is using radio frequency to help warm up the tissue, to help decrease some of the fat, and then percussion to try to break up those fibers. So you're getting a two-in-one type of a treatment. For those areas, it can be used on the thighs, it can be used on the abdomen, it can be used on the buttocks. So again, very
What
exciting.
about under the arm here?
Under the arm, I'm typically using something called the Ageless, and that basically is also a radio frequency device, and that is going to help tighten and help remove some of that fat.
Now, is it dangerous to use any of these or decrease fat?
Well, there are some contraindications to everything. So the most common thing would be anyone with electronic implanted devices really shouldn't be using the radio frequency and electromagnetic. So the electromagnetic M-Sculpt and M-Cella are similar to an MRI machine. So you don't want metal. That would cause some problems.
Great. So all body piercing and rings and earrings shouldn't be worn in when you're getting these procedures.
Right. We don't want any metal in the area of the actual treatment, depending on what we're doing. So if I were going to be doing a procedure on your neck, then I would want obviously your necklace off and earrings.
Well, and how long do the results last from all of these typically? Or first part of the question would be, how long does it take to see the optimal results?
Mm-hmm.
And then how long do they usually stay? Because I've seen some sporadic studies with M-Scope. I saw studies that showed it lasted for almost 4 years with minimal maintenance.
Mm-hmm. That's a great question because everything depends on the person. So depending on the person's health, depending on their type of skin, their genetics, their environment, how healthy a lifestyle they have, are all going to affect their results. Most people will start seeing results during their treatments. However, typically about 3 months out from most types of equipment, most types of procedures, they're going to be seeing their optimal results, which can last 6 months, can last longer, can last years. We're basically turning back that clock. But then you start aging again. So it's your responsibility to continue with a healthy lifestyle and maybe some maintenance. So it's hard to say, give a definite type of answer to that.
But do you find that your patients, after doing these type of procedures and maybe coming in later for something lighter, do you find that it actually encouraged them to change their lifestyle?
Definitely. For some patients, it just gives them that extra boost to be able to go out there, be more active, eat a little healthier, work out a little bit more. But I'm also seeing patients that maybe at this point are still afraid to go to the gyms because of COVID. So they can come in one at a time into the treatment room, relax, and have a medical type of workout without having to go into the gyms. So it's exciting. I certainly see a lot of patients who this is just the beginning for them. And we're giving them that launching pad so they can just soar. And it's so exciting because once it can be a domino effect. You treat something, they feel better, and they go ahead, do a little bit more, feel a little bit better. I've seen some of these procedures be life-changing for women, especially the laser hair reduction on the face. Women shouldn't have to go through life with a male pattern beard. So I've been able to help women in that area and be able to have them feel more confident about themselves.
Does the laser hair removal, does the hair grow back like a stubble, almost like a man stubble, or?
No.
It doesn't? It doesn't just go away forever?
Some of the hair you can treat and it'll go away forever. Some of it, depending on what's causing the hair growth, May come back over time slowly, but what we're doing is we're getting rid of that. It's going to become lighter. It's going to become finer. It's going to become much more easy to manage. And for some women, I've had women come in that actually you could take the credit card and scrunch even after they've shaved. It's been a whole game changer for them. It's really exciting. I get so happy
I
about seeing
know.
people, feeling better.
Definitely. What about bikini lines? Would that be good for bikini lines as
It's
well?
awesome for bikini lines, underarms, legs. We don't,
Does it hurt?
that one's a little bit more like the rubber band snapping, but we can
Really?
use a little bit of topical lidocaine cream.
Does that
Prior.
kind of numb the
It
area?
does. It numbs the superficial skin. Yes.
Ouch.
Yeah. But it's all worth it.
Really? That sounds great. And then we have Evoke.
Evoke. I'm so excited about that one. That's my new one. Basically, it again uses radio frequency and it heats up the tissues. We have 2 hand pieces for it. The first one is great, is for the jawline. So it comes right above the jawline, up a little bit here, and you set it, and the electronics totally just read the skin temperature and keep it set exactly where you put it. So I can set the patient up on the Evoke, and it's a comfortable, nice, relaxing treatment. And we do them 1 week apart for a series of 6. And it's going to help tighten that jawline. It's going to help with the jowls. And it's just another option for women so that they're not undergoing surgical procedures.
Right. And how long did it take you to get your results?
Again, a few months. So I started, and then COVID came along, and so I took some breaks and went back, and so I've done a total of 6 sessions, and I'm astounded with my before and after. I'm really happy with it. So I did not only the jawline, but I did submental. So right underneath, a little extra skin here, a little extra fatty tissues. It helps to tighten this. So,
And it showed on your before and after pictures that it seemed to have like lifted the
mhm,
whole neck.
yes, as you are getting rid of the fat here and tightening this skin, it gives you more of an angle between the jaw and the neck, and gives you a much more elegant look.
That must make women feel really good.
I feel good about it.
Definitely. Can we say your age?
Okay, 63.
63.
63.
Wow.
Yes.
You look great.
Thank you.
So that must be comforting. And then when your patients come in, they must have a whole host of reasons for coming, whether it's divorce or they had a baby or they're a stay-at-home mom and they can't get out as much.
Mhm.
What's the benefit of going to you versus as a licensed professional compared to some other places that might not recognize signs that they're talking about?
Okay. Well, I think what I bring to the table is I generally care about all my clients. I take the time to listen. And what I want to do is provide the best care possible that I can. So every day I go to work, I do the best that I can. And I work with the clients, try to do what is best for them obviously within their budget, within their means. And sometimes it's just, listening to them and giving them some options that I may not even be able to provide for them, but I can give them, doctors or other areas that might be able to do something. But we have such a wide array of things that we offer between Botox and fillers and lasers and intense pulse light and the whole gamut of body sculpting. I do have a massage therapist at the office and a licensed esthetician. So we offer a wide variety for the women that are a little bit beyond what they can get from over the counter,
Mhm.
and they may not know what chemicals in the different products are good for different applications. And then we're underneath the plastic surgeon. I do not do plastic surgery such as facelifts or eye surgery, but I can get people The results, they're just underneath surgical results.
So with some of these, are they not good for like the or the hair removal? Is that
Mhm.
not good for some like different colored skin types?
Certainly. There are different lasers that you can use on different skin types. Currently, I do not have a laser that allows me to do the darker skin patient. Um, but I know what lasers do work and can advise someone where they may be able to find that type of procedure. So I do, lasers do not work on white hair. You have to have melanin or pigment in the hair
Hmm.
in order to be able to reduce hair. Um, all of these things need to be taken into consideration. And again, whether somebody's tan, not tan, I tell people the equipment doesn't know brown that you want to get rid of versus brown you want to keep. It doesn't have that high of a brain power yet. So don't try to do intense pulse light if you're tan, or if you have self tanner on, because again, brown.
Right.
So these are things that need to be discussed during a consultation. And so I try to be very thorough in my consultations to allow people the understanding of how the equipment is going to work, how it's going to work for them, if it's going to work for them. And then we discuss it together and set up a game plan. And sometimes this takes time to do that, but we're there to listen and we're there to guide and just work very closely with our clients.
Well, the way that I found you was that I was really interested in the sculpt.
Mhm.
And I had checked literally the whole East Coast from Connecticut, Boston. How are you able to offer more affordable prices than what we're seeing across the board?
I do many of these myself, so I do keep staff to a minimum, and I just try to keep it affordable to people. I look at what I might be able to afford or what I feel is a fair price, and um, and go from there. I'm If I wanted to be in a more lucrative area, I could. Um, but yeah, I think it's all how I would like to be treated and prices that I would be willing to pay.
Definitely. Well, thank you for sharing so much about what you do and what's new for self care. And I hope you come back again to share more with us.
Well, thank you for having me. I've been so excited. I've been looking forward to it for weeks now, and love to come back and share with you and your audience a few other types of services that we can provide for them.
That'll be great. Until next time, keep asking questions. And if you're interested in body sculpting and just making yourself look and feel better, check out the Ageless Medical Spa or a spa near you and just make sure you check their credentials for safety. We'll see you soon.